I'm Dr. Zhuang from Vision Clinic. Today we want to talk about the reduction rhinoplasty. This surgery is not common in Asian countries, but we are very good at such kind of procedures. And this pretty girl is Mohani. Yeah, she is my patient. She comes from Jordan. And you may remember 3 months ago, she comes to visit me and complain of the big nose. And there are 3 parts in her nose. I think this is the problem. The first one is the big and strong bridge. And the second part is bulbous and big tip, a round tip. The third one is flare with wide nostrils. So you remember that we have discussed many times about these surgeries.
Yes.
So do you know the details about what I'm doing for you?
Well, as far as you told me, like I had a hump over here that had to be disappeared, and I wanted to have a pretty tip and a reduction of the wings over here.
Yes. Because such kind of surgery, we always include several procedures. The main part is the bone reduction. So I perform the lateral corrective osteotomy to reduce the real width of the bridge and the base. And that will make you have a more slimmer and maybe a thinner bridge and make you have a more feminine look. And secondary is the tip-plasty. It is the main part of this surgery because usually the bulbous tip correction is not easy. So firstly, we remove part of the soft tissue inside the tip for her to reduce the volume of the soft tissue. And secondly, I harvest the septal cartilage to provide a better support of the columella. And this is good for the tip and supra-tip projection. Yeah, just like we call it the tip and supra-tip projection. And the third one is that I remove the extra and redundant lower alar cartilages. And this is very important to create a triangular shape. And this is what I've done for her. And the last procedure is the alloplasty. We remove the part of the skin above the alar base to reduce the width of the nostrils and the eyelids. Yeah. So that's what I've done for her. So do you have any question to ask me? I mean, maybe the risk or something that the patients need to know?
Well, were there any complications that I had to be aware of?
Yes. Such kind of surgery, we always be attention not to do it overcorrected. Because if we reduce the nasal bone quite small or quite narrow, it will break your breathing. Because when the bone is reductive, that will be also obstruct the internal pathway of the, we call it internal airway. So you will get in trouble in breathing, especially in a very cold winter. Yeah. Secondary is a kind of aesthetically, the aesthetic result. So I think the physicians and the should have many times to communicate with the patients. I must realize and know about what you really like or expect for. Yeah. And under such kind of a detailed discussion, then we can make a similar result that you want, right? So that's the reduction rhinoplasty that we need to take care about. Yeah. So.
Well, I'm quite satisfied with the final results. I like it. Thank you very much.
I appreciate it. Okay. I'm Dr. Zhuang in the Vision Clinic. We welcome the patients all over the world coming here for my surgeries. So if you have any questions, then please contact me with through the email. I will reply you as soon as possible. Thank you.
Bye-bye.
Bye.